Hey, welcome back to Way Too Early. It's 5:30 on the East Coast and 2:30 out west. I'm Sam Stein. A number of Senate Democrats are calling for Health Secretary Robert F. Kennedy Jr. to be fired for his role in having CDC Director Susan Monarez pushed out. In a social media post, Democratic Senator Michael Bennet of Colorado called Kennedy a, quote, catastrophic failure and a clear danger in office, adding the HHS secretary never should have been confirmed. Democratic Senator John Ossoff of Georgia called RFK Jr. a, quote, quack, adding that putting him in charge of public health was, quote, a grave error. Multiple Democratic members of the Senate Health Committee, which oversees and creates legislation related to health care and public health issues, also called for Kennedy to be removed. Joining us now is NBC News medical contributor Dr. Vin Gupta. Vin, thanks so much for doing this. Really appreciate it. Can you just unpack from a medical perspective what this clash over the vaccine committee is all about? What is the advisory panel responsible for? And what changes do we know they wanted, I guess now former CDC Director Monarez to sign off on?
Yes, Sam, good morning. ACIP, the Advisory Committee on Immunization Practices, they are a committee of epidemiologists, immunologists, deep experts that don't become experts in vaccine science overnight. This is a career. And they're designed, usually to bridge administration, so they tend not to be just political appointees for just a few years. But they advise the CDC director on what vaccines should and should not be endorsed for the subsequent respiratory, say, virus season. And so they're the eyes and the ears of the CDC director, of the FDA commissioner, the leading health officials on what vaccine formulations we should be pursuing and when to do it. Without that, the CDC then doesn't really have an advisory committee mechanism or any mechanism to then recommend shots for, say, September onwards, as they typically would do for COVID, flu, RSV, you name it, Sam. And so that's the sticking point here, is that he has effectively neutered this mechanism that then subsequently is relied upon by the CDC to endorse, and then for states to actually make clear guidance, because state law, Sam, when it comes to vaccination, depends on what this advisory committee recommends and what the CDC endorses.
So now we have a situation, and it's a little bit hard to sort of figure out where we're at because it's so chaotic. But the advisory committee is set to meet, but Bill Cassidy, who chairs the health committee, says they shouldn't meet because there's too much chaos at the CDC for them to meet and for anything to come out of it being respected. And then you have reports like the one that is out in the New York Times of pharmacies like CVS in, I believe it was 16 states, not offering, holding off on offering the COVID vaccine. There's a lot of people who are going to be out there wondering, am I going to be able to get access to vaccines that I think are critical for my health? Obviously, it's different for different vaccines, but what would you say as of right now in terms of access to those vaccines?
It's in trouble. And this is where RFK and his team know what they're doing. Sam, they came in with years of anti-vaccine stances. And what they've done is they've recognized the mechanisms by which, say, a pharmacist in a retail pharmacy down the street, what you and I and others rely upon for, say, vaccines and our medications, what they can and cannot do and how they can and cannot do it. A pharmacist in many states can only vaccinate against, say, COVID-19 in this respiratory virus season if ACIP renders that endorsement to CDC, who then signs off on it. If they don't do it, Sam, as we saw this morning in 16 states, CBS is saying, you know what, we have to press pause. We cannot vaccinate because we need a CDC endorsement of the COVID-19 booster to allow our pharmacists to do their job. So for all your viewers out there, RFK understands, and his team understands what and how pharmacists can do what they do. They need his approval. And without his approval, and most Americans, Sam, this pandemic onwards, get their vaccines at retail pharmacies across the country. By simply neutering this mechanism, he is impinging on the ability of pharmacists to do their job, and effectively has rendered access to these even more restrictive than the ways in which they narrowed the label just a few days ago.
It is remarkable and somewhat scary times. NBC News medical contributor Dr. Vin Gupta, thank you so much, man. Really appreciate you coming in and unpacking this for us.